are here today to give you a progress report on what we have done, and we do not have our proposals ready. That won't be ready until January 19th. And so I just want to make that clear. We're going to tell you about what progress we made and a little bit of our findings, but we will not be making any proposals. And Steve will begin, and I will try to fill in the gaps.
It's always a little frightening to go first.
Yes.
Could we interrupt you briefly to ask you to introduce your team? I know that you.
Oh, I'm sorry.
And it might be interesting for people just to see who's part of your team.
Yes, Steve Kappel is sitting to my right, and I think he's well known to all the people in the room, and he is a key person on our team. The other team member who is not here is John Gruber, who is doing the, I will tell you a little bit of what we found on the affordable care. You were asking what's the impact on affordable care. We simulated how the affordable care will impact on Vermont. And my other teammates who are here, I'm just going to go from left to right. Ashley Fox, she was at Harvard, but now Yale rated her, and now she's at Yale. And Nathan Blanchett, and both of them really are handling the stakeholder analysis. They have interviewed more than 80 people in Vermont, and also speaking to different groups. Then is Anna Gossman, and she's the manager of this project. And my life is in her hands.
Thank you.
Good afternoon. Just to clarify, all of our lives are in Anna's hands. So, my assignment was just to start out, give you all a little background, kind of discuss how we've gotten where we are today, and then Dr. Shah will talk about some of the results. Some of this will be a little repetitious for the folks who've been to every one of these meetings, but I've noticed every time I come around here, the room is fuller. So I know there's a lot of new people, so hopefully this will be helpful for everyone. So Act 128, which is guiding all of our work, does lots of different things, but we're going to focus on two. It establishes principles and goals for healthcare reform, and then it calls for three proposals. First proposal is a single payer plan, and that's defined in the bill. Second is a public option defined also in the bill. And the third option is one designed by the consultant, and then in quotes, taking into account principles established in the Act. So that's the one we have a little more flexibility around. Our way of approaching this question is to identify the things we want to maximize and then try to strike a balance with the things that constrain us in that quest. So what we want to maximize are coverage, number of people covered, benefits, how comprehensive that coverage is, the efficiency of the healthcare delivery system, quality of care, specifically in response to the bill, the importance of primary care in the system, and finally our ability to control costs. Major constraints we're wrestling with just how much funding is available for this project, both in terms of what can Vermont afford and also how can we maximize federal dollars. There's lots of places in this process where decisions we make can help us attract more or less federal money. So our goal is to attract as much as possible. Federal law, there's lots of other things in play. ERISA, which everyone has now heard about ad nauseum, PPACA itself, and then finally, what are the political realities that we have to work within? The political realities, I think we have done, Ashley and Nathan actually have done a lot of work trying to understand the politics in Vermont. What positions do different stakeholders have? How do they balance out? Where are opportunities for discussion? Legal analyses, we have talked to what I think we've all identified as the best experts on ERISA in the country. They have been enormously helpful. We've also gotten a lot of help from legislative staff, particularly in trying to understand PPACA, all 2,000 glorious pages of it. Clearly, the better we understand that bill and how our proposals interact with that bill, the better we can optimize all of our work. Financing is, for some of us, the interesting stuff. How much money will we actually need? What's the total funding requirement? That will obviously depend on what the benefit package looks like, how different providers are reimbursed, and then the savings we can manage to achieve from several different areas. Administrative costs, organizational changes, so how providers interact, how the provider system is structured, potentially tort reform, and to the best of our ability, reducing waste, fraud, and abuse. Another area of finance we're looking at, the idea of repricing. So right now, pretty much, it's like flying on an airline. Everybody pays something different for the same service. So we're looking very closely at what would happen if everyone paid the same thing for the same service. Who would win, who would lose, what would that effect on aggregate spending be? Third major financial question, how much do employers in Vermont currently pay for health insurance? Exactly how we get to that, a couple different sources, none of them are unfortunately perfect. Broader economic analyses, there are lots of different ways to raise money. We're trying to understand the pros and cons of each with a particular focus on equity. How do different systems become more or less equitable in their contributions, but also how are they treated under federal tax law? Again, back to our goal of trying to maximize federal money, we want to also maximize our ability to use tax law to protect Vermonters from having to pay any more federal taxes. What are the impact of reforms on state and federal spending? What are the impact of reforms on household and employer spending? All of those analyses will be done in contrast to our baseline analysis, which we're just about finished now, which is post-implementation of PPACA. So the baseline is not the current, the baseline is after PPACA goes into effect. Finally, and probably the broadest view, what are the consequences to Vermont's economy? So this will be the macroeconomic analysis we've talked about. How will reform affect the gross state product? How will reform affect employment in the state, average wages, things like that? And that piece of this is being done by a few new members of the team, Kappel and Rockler. I think you all know them from their work on the state budget. Last few things we're looking at, pay for performance. We want to understand how it works, when it works well, when it has the effect everyone wants it to have. Risk adjustment. So assuming you have different pools of people, how do you account for the differences in the rate they consume health care? What are physician workforce characteristics going to look like in the future? How can we best recognize the changes we're going to produce in the system and how that will impact the demand on physicians? And then finally, a question that's come up a couple of times, the question of migration. Should we expect a large influx of folks to Vermont if we proceed with reform? And that's an interesting challenge because states haven't done this before. So we're looking to other reform efforts that states have done in other areas to try to understand the attractive force of reform to folks who live in other states. Questions on all of that? And we're having a wonderful time doing it all.